Justin, can you take over?
Now, going over some statistics of hearing loss in Arizona, there are over 1.1 million individuals in the state of Arizona with the hearing loss. Over about 739,000 of those individuals are over the age of 60. About 20,000 or potentially more individuals in the state of Arizona are culturally deaf, which means American Sign Language is their primary mode of communication. I happen to be culturally deaf. I prefer communicating through American Sign Language, and I use ASL interpreters as my accommodation. 2.3 out of every 1,000 babies born in the state of Arizona have some degree of hearing loss. All babies born in the state have a newborn hearing screening done to ensure that babies can be identified with the hearing loss younger and that resources can be provided to avoid language deprivation. So there are programs and services available for children starting at birth to have those services for the rest of their life. And about 20% of teens in Arizona have some degree of hearing loss, and I'm sure you know why. With technology these days, everything is coming to your ear so close to the eardrum. That sound is right next to the eardrum, whereas back in the day where maybe we had boom boxes on our shoulder that were a bit loud. Also, with the holidays coming up, we always, every season, focus on noisy toy prevention in order to caution parents and grandparents to not buy toys that may be excessively loud that can cause hearing loss in children. This slide here shows you a variety of auxiliary aids and services that are available. And these are provided pursuant to the Americans with Disabilities Act. If someone is deaf, hard of hearing, or deaf-blind, you may ask them what accommodations or auxiliary aids may be best for them. But it's best that you don't make that decision on their behalf because we typically know what accommodations work best for us. You can see they're as simple as handwritten notes, which can work in simple situations. You also see teletypewriters where TTY on there. That technology has become pretty antiquated because it relies on a landline. The last time I used a TTY was probably about 20 years ago. Assistive listening devices. You can see that blue icon over there, and you may see that at different facilities, meaning that there are assistive listening devices available. Speech to text may also be used. It's a nice accommodation for me if I'm at Target or if I'm at the grocery store and I can, especially with COVID, I don't want people to be touching my phone, and with everyone being masked up, it's hard to lip read. Also, real-time text. We are using Communication Access Real-Time Translation today, which is a real live captioner who is providing us with these captions. It's much more accurate than automatic speech recognition or ASR. We have an actual person who is providing these captions for us remotely today. Video remote interpreting is remote interpreting. Most hospitals or doctor's offices do provide video remote interpreting. It's one of the options for an accommodation. You see ASL interpreters listed there also. That's typically for in-person interpreters. Video phones, that's how deaf individuals typically communicate. We place our calls through a video phone. It looks pretty much just like a FaceTime call. I can call my deaf friends. I can call my family members who sign. But if I wanted to call someone who doesn't sign, like my provider or a nurse, I can connect to you through a sign language interpreter. Also, closed captioning is another important accommodation. Going to the movies now is a possibility for deaf and hard of hearing individuals. When I'm in the lobby somewhere or in a bar, I'm able to read the captions on the TV. Also, hearing loops are something that works with hearing aids and Bluetooth technology. Service animals as well. Service animals can go pretty much anywhere. Also, visual signaling devices. Your facilities should have visual signaling devices, which should have a bright strobe light on it and also a loud alarm. So if I was to be in my office alone and something happened, I could easily evacuate. You wouldn't have to worry about me being stuck in here. I could evacuate independently. This slide here is really important. This is a guide to terminology. You can see 4 terms on here: deaf, deaf-blind, or combined vision and hearing loss, hard of hearing, and I am deaf. It's important that you remember these 3 terms because these are the culturally appropriate terms to use in order to identify a person and their communication needs and the resources available to them. You can see the 4th term up there is hearing impaired. And I would like to mention that saying hearing impaired is considered offensive. It's a term that we no longer use. And also, if you say hearing impaired, it's too broad. If you were to reach out and say, okay, I have a hearing impaired patient and I have some questions about what services to provide, it's not specific. I don't know what services they may need. Whereas if you say I have a deaf patient, that helps me narrow it down to help you know which accommodations are best to be used. So we prefer the terms deaf, deaf-blind, or combined vision and hearing loss, and hard of hearing. And Christy will be talking about the hard of hearing community and why we don't use the term hearing impaired. I'll turn the time over to her now.
Good afternoon, everyone. It's great to be here with you today, and I hope everyone can see me clearly and hear me clearly. My name is Christy Abrams, and I am the hard of hearing specialist here with the Commission. And I've been with the Commission just over 2 years now, and it's really been such a privilege to serve in this position. As Kim was sharing, I represent the hard of hearing community. Hard of hearing is just a widely accepted term that we use to describe someone who has mild, moderate, or severe hearing loss. Often this could develop during childhood or maybe later in life. People who are hard of hearing do have spoken language. We may wear hearing aids like myself. I wear 2 behind the ear power hearing aids. There's all different types of hearing aids, of course. Some people have cochlear implants and other bone anchored devices such as a Baha. So there's different variations there. And in most cases, it's really important to know people who are hard of hearing, unfortunately, usually don't know American Sign Language. It's something I'm really wanting to learn, but it's not something that I had access to growing up. And as Kim mentioned, hearing impaired, it's just not a term we really like. When I was little, I was told this a lot: you're impaired. And it just really kind of has that feeling of something's broken and something is wrong. So over time, that's just really been a term that we're trying to get away from. I also want to just point out, you may hear the sound of my voice. It's definitely, people will sometimes say, where are you from? Somebody said, are you from Australia? I do, my voice has been shaped by my hearing loss. I don't hear all of the sounds of speech, so I have a little bit of a unique sound to my voice. And you may notice that or pick up on that with some of your patients, but not everyone, but it might be something you pick up on. Okay, next slide, please. Okay, and as I was mentioning, well, first of all, hearing loss is really important, right? Hearing loss is an invisible disability. If you saw me coming into the office, I mean, my hair happens to be longer, so you can't see my hearing aids. And a lot of people, devices can be really small nowadays too. And so you just may not have any idea that someone has any level of hearing loss. Sometimes people have a mild hearing loss and they may not even be aware of it. Maybe their friends and family are becoming aware of it because they're not getting everything, or they're asking to have things repeated, or maybe the television is on quite loud, things like that. Once someone starts to have more of a moderate hearing loss, at this point in time, hopefully they're starting to have their hearing tested and they begin to wear hearing aids. Unfortunately, many don't. Many people who need hearing aids don't wear them. but it's really helpful at this stage. Once someone has more of a severe hearing loss, like myself, even the sounds of speech are still difficult to understand because, like glasses correct our vision, hearing aids do not correct our hearing. They help a lot, and technology keeps getting better and better, but we still need other communication strategies in order to have that effective communication. Once someone has a profound hearing loss, hearing aids really are no longer going to help with speech. They may help with hearing some environmental sounds, but they're not going to give you that access to speech. One thing that's important, for an example of myself, when I'm at the doctor's office or meeting with healthcare professionals, whoever's speaking to me, their pitch and their tone, that can really make a big difference. If I'm speaking to a female who has a really high voice and she speaks quickly, it's going to be hard for me. But if I'm speaking to a male and he has a lower, deeper voice, I'm going to catch more of that because that's where my hearing range is. So it's just important. That can make a big difference for someone. And right now, of course, we're all wearing masks, and so that makes it really hard too. All right, next slide, please. So one thing I really just want to point out and to have everyone keep in mind, when someone if someone's mishearing, they're misunderstanding. And I have so frequently people will tell me, if you don't hear me, just let me know, or let me know if you don't hear what I say. But if you really think about that for a minute, that's impossible because there's no way I can let someone know what I didn't hear. But it's just, something to be aware of. With my hearing loss, I don't hear the sounds like t, sh, f, f, d, p, k, sh. And that is, if you think of, I think of like Vanna White on the Wheel of Fortune turning around those letters, right? And those are the sounds that I always don't hear. So I'm always putting together a puzzle in the conversation. And I'm always working really hard. I'm very vigilant, and I'm trying to understand what someone's saying. And it's good to be aware of this because if you're in whatever setting you may be in, for example, if someone's a home healthcare worker, they may say to someone, you have an appointment at 3 on Tuesday. The person may hear, oh, okay, I have an appointment Thursday at 3. And they think they heard that. So it's really easy for mistakes to happen. The doctor may say, be sure to take 15 Cs twice a day. And the patient may hear, take 50 cc's twice a day. So just these little things, our brain gives us what we think we heard. And a lot of times, unfortunately, hard of hearing people may not say, I'm sorry, I didn't quite catch that, or they might think they heard it correctly. So whenever you can, it's really important to write things down, whether it be appointment times or medication or directions, whatever can be put in writing, that's going to make a huge difference for someone who's hard of hearing. Okay, next slide, please. So this is one of my favorite slides. I always say that when this slide comes up. And I want you to think about the environment that you're in and the environment that you serve patients in. It might be an office or a waiting room. And if this is you and I'm the hard of hearing patient and I'm trying to understand what you're saying, and maybe even we're having a telemedicine visit on Zoom, and this is what your screen looks like, it is going to be so hard for me to face read what you're saying, because being hard of hearing, I really depend on looking at your mouth to help me understand speech sounds, looking at your face so I can understand the emotions, and our face conveys so much, and it really helps me to process information. Even when I have cart and captioning, I really want to have that human face. So really, it seems like a small thing, but having lighting on the speaker's face makes all the difference, especially if you think about it, when someone's coming in, often they're not feeling well, or even for a wellness visit, maybe they're stressed. Is my blood pressure going to be high? Am I going to get bad news? And so all of those things impact the way we hear. And so even for people who have perfect hearing, this can be a difficult situation and it can make it more of a strain. So you really want to consider the environment. Okay, I'm going to let our interpreters change, and I know we're going to go on to the next slide. Okay, so this is another great thing. I'm hoping you'll download these communication strategies and keep them in your brain and keep them tucked away in your memory, because this is really going to make a game-changing situation for someone that's hard of hearing. And I think if you really approach every person like this, then it really helps, because you don't always know who has hearing loss. The first thing you do is get the person's attention, and that might start in the waiting room. I know for me, I always try to sit where I think they're going to come out that door to call my name, because if I'm sitting at the other end of the room and they say Christy, I probably may miss it. So you might want to take those extra steps, walk out to the person so that they get a visual cue. Oh, they're looking for someone, and then just get them that way. Because if you're calling from behind a desk a name out, people who are hard of hearing are not going to hear their name. So it's really important to get their attention. And then once the conversation starts, you want to keep that face-to-face, looking directly at the person the entire time if you can. And I know that's a struggle because we're not used to doing that. We're used to turning around and walking away, and the people are behind us and we're taking them to the scale and they're like, what are they saying? I know. And a lot of times too, we might have a clipboard or a chart, something in front of our face, or a pen, anything that obstructs our face. A lot of time, if you think about how the waiting room or the exam room is set up, if you're faced this way, typing information into a computer, and the hard of hearing person is on the side or off to the other angle, they are not going to hear all of those really important questions that you have. And unfortunately, for whatever reason, hard of hearing people don't always share that they're hard of hearing. They may be in the stage that they still feel embarrassed or just depressed or afraid to speak up about it. So a lot of times they won't speak up. So if you can set your environment up to have that face-to-face communication with all patients, it's going to be great. If someone doesn't understand you, you might look for clues. Again, they may be leaning in or knitting their eyebrows. Look for those cues, because they may not tell you that they don't hear. And instead of saying the same thing again, maybe you're asking for even an insurance card, and they're like, I'm sorry. And then you can say, do you have inside of your wallet the card with your insurance information? So just giving more clues, more information, it really helps to rephrase that and just give a little bit more information. It's really going to help. You want to be sure if someone is in the room with a family member, a spouse, an adult child, a cart provider, keep that communication going with the patient. Sure, the spouse may help a little bit, but you really want to respect that human being and make sure that you're not leaving them out of the circle, because it's so easy to turn to the other person and talk, but you want to include them in that communication circle. The distance between the speaker and the listener makes a huge impact. If someone's across the room, even more than 6 feet away, it's going to be really lost. They're not going to be able to understand what you're saying. Really think about any music that's being played in the background, or TV, or office sounds, any sounds in the background. Those are being pulled into our hearing aids, and those are affecting how we process and hear speech. So whenever you can give a quiet environment, that's going to be so helpful. And again, be mindful of any obstacles that may hide your mouth. If you have a beard or a mustache, that's going to make it harder. A mask is going to make it almost impossible. And again, just pens and clipboards and your hand. If you're talking like this to someone, I get what you're saying, they're not going to hear you. They're not going to be able to see those sounds on your mouth. The other thing is folks, patients do have the right. Deaf patients may request an interpreter, but I will request CART for my medical appointments. And I will get CART on my smartphone or a tablet, and they can give me the captions just like I'm having here in the meeting. And that gives me effective communication and equal access to my medical information. So that's really important. The other thing I want to just share briefly is for brief exchanges, every smartphone can be turned into something that creates captioning. So iPhones, we have that little microphone at the keyboard. You press that and speak, and your voice will be turned into captions. For Android, I use Live Transcribe, which is a free app for anybody that's hard of hearing, and I can turn people's speech into caption. The only caveat here is this is artificial intelligence, so there are errors. So it's not to be used for a whole medical appointment. For a medical appointment with really important information and details, you want to have what we have here today, a live person typing out CART. And I hope you'll remember all of this. And I hope if you ever have someone that's hard of hearing, if they need support or resources, please have them email me anytime. Okay, thank you. Next slide, please. Okay. I'm going to turn it over to Kim. Thanks, Kim.
All right, so now we're going to talk about the deaf population. So the causes of deafness could be a person being born deaf or losing their hearing later. It could be genetic, it could be exposure to loud noises, it could be accidents, injuries, things like that. There's culturally deaf, which means people who use American Sign Language as their main communication. Those folks are going to be who prefer interpreters. As Christy mentioned, hard of hearing folks might want CART. Deaf folks are going to want interpreters. But as well, some deaf people might also want captioning. People might be completely deaf. They also might not know sign language. And then there might be, but then there's also the community who does use sign language. So there's going to be a range of differences of what people want. So that hearing impaired term is a little bit too general and doesn't capture the differences of those populations. So communication for deaf people is American Sign Language. It is a visual language. English is our second language, where it is a written language, but ASL is not. We have, there's unique terminology and grammar. So interpreters are trained how to interpret specific vocabulary. Like, for example, the word run has a lot of different meanings in English, right? So that one word means many different things, but there's not one sign for all of those meanings. Every sign conveys a different concept pertaining to that word run. So for example, a common example would be a runny nose. If someone's nose is running, this is what the sign is. So if you say, I'm going for a run, the exercise, that looks different. My car is not running, that's a different sign. So that's one example of the very many meanings of words. So that's why it's important to have a certified qualified interpreter, because they understand that. If you have staff who know sign language, they might not understand that, and you could get a lot of important miscommunications and communication could break down. So you're going to want somebody who's fluent and qualified and trained. Deaf children many times have hearing parents. 90% of deaf children have hearing parents, and 10% of those hearing parents know sign language fluently and communicate with their children. So 10% out of those 90%. So that means 90% of deaf kids with hearing parents, their parents don't know sign language and don't communicate with them at home. So that causes something called language deprivation, and that has a significant impact on their lives. It causes a lot of delays in development. If their parents don't know sign language, a lot of times they'll have a home-based gesture system. Sometimes they'll use writing, or and a lot of times those deaf folks, when they grow up, they don't really hang out with their family. They don't spend time with their family because they've been left out. So they're really separated and isolated from their families. So those folks also have this lifetime of being frustrated with the lack of communication access and feeling like people don't care. But you guys care about your patients, so just keep that experience in mind. There's also foreign language. American Sign Language is American Sign Language. A lot of people think that sign language is universal. There's only one, but that is not true. Every country has their own, just like every spoken language is different in every country. So we have, they each have their own sign language. There's also folks who have intellectual disabilities or other language skills who are not fully fluent in American Sign Language. For those folks, you can pull in someone who's called a certified deaf interpreter. That is an individual who is deaf themselves, and their expertise is in assessing linguistic and cultural needs and expanding information to make it more accessible to that person who's not fully fluent in standard American Sign Language. So if you notice that you're struggling even with an ASL interpreter, that might be what you need. That's very, very helpful, and a lot of times it can meet your effective communication goals. A lot of times people will decide a person who is deaf, who speaks, knows spoken English, is more intelligent than a person who doesn't, but speech does not reflect intelligence. They have nothing to do with one another. Speech is an auditory access. That's the way that you communicate. That's the way you access communication. I do not read lips, but I communicate perfectly fluently through interpreters. I can write notes back and forth. I can do that. I just cannot hear, and I do not use speech. So that can be a barrier. You might think that their lack of speech is a barrier, but that's not with appropriate accommodations. Lip reading is not an exact science. The best lip readers can only get about 25% of the communication, which means 75% is missing. I do not read lips. My wheat, for example, I cannot see the difference between those words. So those, for example, people, if somebody says, "Can you read my lips?" Just don't do that. It's the same thing as somebody saying, "Can you read my signs?" I mean, you don't know, so that wouldn't be effective. That wouldn't be helpful. So if a person does use lip reading rather as a method of communication, they'll let you know, but don't ask them. Let them tell you that. Also, you'll notice a difference in writing fluency between deaf individuals. You might find someone with a 3rd grade reading and writing level. You might find somebody with a PhD level. It depends on their background. It depends on whether they had access to language at home from early childhood. It depends on, what they had access to. My parents are hearing, but they did sign. So I had language access at home and at school and everywhere. So my language fluency was able to develop from the beginning. So you're going to see a disparity there. Also, writing notes isn't necessarily a communication solution. What you want to do when you are writing notes, though, is make sure that you start somewhere in the middle. Don't go too complicated, but also don't go too simple. Start in the middle and then figure out where you're at and go from there. You also want to check for understanding. You want to make sure that they understand things like, how many pills to take a day. Yes or no answers aren't going to get you that clarification. So you want to get them to tell you what they understand. If you just say, "Do you understand?" you're going to get that smile and nod, whether the person understands or not. So you want to check for understanding and make sure that they can tell you what you said. A lot of folks have experienced a lot of oppression around communication and being expected to communicate in ways that they're not able to. So they've just learned to say, "Yes, I understand," when they don't. So you don't want to have that happen to you. And it is an auditory world out there. People primarily rely on auditory things. Deaf people and hard of hearing people find out information later. There's a lot of gaps in knowledge because we don't hear conversations just happening in news and radio. We get information later. So what you want to do is to make sure that all of your materials that you're providing for people are accessible, captioned, interpreted, or both. You want to make sure that your policies and everything that you have in place, maybe they don't know a thing, they have gaps and disparities in knowledge that they don't know what a copay is or that it's required. So you might encounter those types of things. You want to make sure that the information around those things is accessible. We also have a support service provider program for deaf-blind individuals, and I'll explain more about that. Deaf-blind accommodations can be service animals, and you are allowed to ask 2 questions about service animals. You cannot ask them, "Why do you have a service animal?" But you can ask, "Does this animal perform a task for you?" And also, if the animal is barking or being aggressive or misbehaving, you can ask the animal to leave. Interpreters as well For deafblind individuals have specialized training. When you request an interpreter, you're going to ask for an interpreter who has experience either with tactile sign language or close vision sign language, or the specific type of language that deafblind individual uses. Because if you just ask for an interpreter, that interpreter may not be qualified for that particular situation. Some deafblind people do use speech to text with large print. You might encounter that. They might use assistive listening devices. Low vision folks might want large print if you have forms or paperwork that needs to be filled out, making sure that that's available in large print formats. Not everyone knows Braille, so Braille might not be a solution for all individuals. Support service providers are providing environmental access. They're a sighted guide for a deafblind individual. They could be deaf themselves or hard of hearing or hearing, but they are not an interpreter themselves. If a deafblind individual needs that service, they can contact us to get that. So the Americans with Disabilities Act is a law that protects individuals with disabilities, which includes deaf, blind, and hard of hearing people. That for us, that's communication access. So it's equal access to effective communication and auxiliary aids. We have so that we can gain the same benefit and the same access as a hearing person. The Americans with Disabilities Amendments Act covers newer technology like video remote interpreting. And Section 504 is federally funded things. Federally funded programs are required to prevent discrimination. We do provide advocacy and consultation about that, but we are not attorneys, so we cannot provide legal counsel. And now covering interpreters. Qualified interpreter means an interpreter, whether in person or remote, who is able to interpret effectively, accurately, and impartially, receptively and expressively. That's very important. You cannot use children, family members, anyone like that to provide the interpreting services, and you cannot require the individual bring their own interpreter. You are responsible to provide interpreters for your clients or patients. So this is what the license looked like. As I mentioned, ACDHH oversees interpreter licensure. It is the law in the state of Arizona. So interpreters are all required to possess one of these licenses. You'll see them with a badge that looks like this, and the categories are legal, general, and provisional. Provisional interpreters generally cannot work alone. They have to have a team, have to be teamed with somebody who holds one of those other license types. And the legal interpreters are qualified to work anywhere, including legal settings, and then the orange badge, those folks just can't work in legal settings. So you'll see they have a picture, they have the picture of the interpreter and the names on the interpreter. Our interpreters are licensed today, and if you see the interpreters, you can ask them to see these licenses. So this is the cheat sheet explaining the different settings that interpreters can work in based on their license. There are also deaf interpreters, as I mentioned, and they have certification and licensure as well. And as I said previously, based on, remember the example of the word run, interpreters are trained to understand how to accurately interpret a message conceptually. They're they go through many years of training and practice and taking workshops and continuing education to maintain their qualifications. If you have a staff member, a support service person, a family member, you have no way of knowing what their background is or what they understand or not. They can misinterpret things and cause significant harm. Maybe a deaf person said that they they injured their arm and it was the left arm, and then the hearing person said the wrong side, it's the right side. So for example, when I sign the word left and I sign the word right, I don't sign left on my left hand and right on my right hand. So if I'm right-handed and I say left, that person might misunderstand and think that it's the wrong side, and maybe they could end up getting the wrong side operated on. So it's important that you have a qualified interpreter to understand all of those those minute details. So interpreters are also covered under HIPAA. They are also covered under their own confidentiality rules. So everything is confidential. And maybe a deaf person might not, maybe a deaf child, a hearing child of a deaf individual might do something like not wanting to protect their family member and filtering out things like a cancer diagnosis because they want to protect them. You don't want to have an unqualified interpreter doing that. So video remote interpreting as well is very commonly used. It's different than video relay service, so I'll explain the difference. When you're using video remote interpreting, you can, but you have to meet the federal legal requirements for doing so, which are you have to have a clear quality image. It can't be choppy or freezing or bad quality. You have to be able to hear the interpreter, and the interpreter has to be able to hear the people in the room. The screen has to be large enough and clear. The staff also need to be trained and understand how to use the equipment. So you can't assume that the deaf person knows how to use the equipment. Every equipment is different and every provider uses different software. So if somebody hands me the equipment, I don't even know where the button is to turn it on. So if you fail to meet any of these qualifications, then it was no longer considered effective communication, and you will need to get an in-person interpreter or reschedule the appointment. You really want to make sure that your VRI signal, your signal is good, and that everything is working appropriately so that it's effective communication. Remember, that is the standard, effectiveness in communication. And you'll have situations where you're not able to use VRI. Deafblind individuals are not able to use VRI because they can't see the screen. Even sometimes if it's completely up to their face, they still can't see it. Maybe if it's heavy, they're heavily medicated or in a lot of pain, they're not able to think clearly enough and focus on the video. Maybe if they have something going on with their eyes. Maybe if it's a sensitive topic, or they need to speak with the specialist. So I have a story that happened. Someone speaking with the specialist using video remote interpreter and being told that you have cancer, and then they said you have cancer, you only have, and then the video cut out. And the deaf person says, I have cancer, I only have what? And they have that panic setting in, and that stress and that undue emotional turmoil because of the technology failure. So something like that would not be appropriate for video remote interpreting. Large group meetings where everyone's having a discussion, back and forth discussion, that's not appropriate for VRI because it's very difficult for interpreters who are not in the room and can't see everyone to identify who's speaking and help the person track what's going on. If you don't have enough equipment, you can't use VRI. If you only have one machine, and then 10 deaf people show up in your office at the same time, then you won't have sufficient equipment to cover that. So you have to make sure, again, that everything is in place. Communication strategies for deaf and deafblind some are the same as for hard of hearing folks. Interpreters, when you're using an interpreter, the same as with hard of hearing folks, you want to direct your communication to the deaf individual. You don't want to talk to the friends and family about that person. Ask that person directly and let the interpreter interpret. They can give you that information themselves. When you ask someone to take a note, give them a moment to write whatever it is you said to write, because they can't look at the interpreter or at you and take notes at the same time. So make sure you give those pauses for people to write things down if needed. If the appointment is going on for 1 or 2 hours, or it's very technical or heavy, you might need to either book more than one interpreter or have breaks built in. Some rehab centers are 24/7. for example, and they might think, well, do I need to have an interpreter all day? Well, maybe not. Maybe, you know, when the communication is happening, then yes. And maybe they can work out the schedule for when heavy communication is happening versus just basic things. We also have communication cards for vaccine sites if you're interested. If you want to go on our website and look at the communication cards that we've made up, those are very helpful. All right, so I'm finished with my portion, and if you have, we're open to questions from anyone who's got questions, and hopefully it seems like we're just about at time.
Feel free to turn your cameras on if you have a question, or also type the question in chat. I'm going to stop sharing our presentation.
Thank you, you guys. So there was a few of the audience that was asking if they could get the presentation emailed over to them so they can keep reference for, and they added their email so I can get those over to you. So you guys can send that over if possible. Okay,
definitely. And if you're interested in receiving this training is generally a 2-hour training. And so we're happy to give this training again. Feel free to reach out to us. We can tailor it to whatever your work site needs. If you need an employment training, public safety, medical, whatever it may be. Any questions? Now's your chance. You got the subject matter experts right here in the room with you. If you don't have any questions, that is quite all right. Feel free to reach out to us at any time. We'd be happy to answer any questions that you have.